session, which is on children's social care, and we'll be taking evidence from two panels this morning, the first of which will be Stephen Kingdom, Campaign Manager at the Disabled Children's Partnership, welcome, Katie Ghose, Chief Executive of Kids, you're very welcome to the committee, and Tina Emory, OBE, Co-Chair of the National Network of Parent Carer Forums, Community Interest Company. Thank you very much for coming this morning. Can I ask first, how effective has the government's Children's Social Care Implementation Plan for Stable Homes Built on Love and the SEN and Alternative Provision Improvement Plan been so far in improving provision for disabled children? Perhaps come to you first, Stephen.
I think probably the answer is not very. I think we don't know to a large degree. I think it's quite difficult. It's not very transparent to see what's happened. There was a lot we could welcome in both plans, but there wasn't as much investment as we'd like to see, particularly I think on the social care implementation plan, where there wasn't the level of investment that Josh McAllister's review had asked for. And at the moment it feels like there's been a lot of setting up of pilots, of pathfinders, and we haven't yet seen what that's, the impact for that on families, and their lives day to day yet.
Okay, so early days, a lot which is piloting rather than really doing at scale. Katie, do you agree with that?
I'd agree with that. The plans aren't effective in improving the situation here and now for disabled children, young people and their families who are facing enormous challenges. They are on multiple waiting lists. They are facing lack of access to childcare. Only 6% of local councils say they have sufficient childcare for disabled babies and toddlers. Wraparound services are falling by the wayside. Disabled children are not in school. And it's that early support that isn't being put in place. So there's good plans and intentions. Right support, right place, right time, as the government says, is the right ambition. But here and now there's a crisis, and that needs to be fixed right now. And
I see you nodding there, Tina. From the parents' perspective and the Parent Carer Forum's perspective, it sounds like you see a similar picture.
Yeah, I think that stable homes is a bit of an issue for our families. Our families want stable homes, seek support, but do not get it. Often they are pushed into often children's social care is split into two. So you've got what I would call normal children's social care, and then you've got the children's with disability teams, and the two don't talk. And if you're on the pathway, if you're on a waiting list to get a diagnosis and your child has got challenging behaviour, for instance, and has no diagnosis of autism or ADHD, but are on the pathway, you get put into the normal children's social care, and it's instantly about safeguarding, parenting courses, and actually what they want is the support at the right time, as Katie says. So I think the ambition is right, but the here and now is not happening, and lots of people are thinking ahead and are testing. So we've got lots of testing as part of the SEND AP work, of which social care will be part of that. But it's not happening here and now, and the amount of families that we know that are in crisis, that are really struggling just to go to work, for children to go to school, to get childcare put in place, it's a real struggle, and parents just want support and strategies to help their child, not being told that they're a bad parent and they need to go on a parenting course, which is what it feels for them.
And in terms of addressing that, what would you have liked to have seen from the plan? What would make a difference in terms of the thing that perhaps for each of you would make the biggest difference in terms of an early intervention, something that could be done swiftly to support parents better in this space? Katie, can I?
Yes, so I've got an example. In Wakefield in Yorkshire, we are running a holistic crisis intervention for families who are stuck on waiting lists, so young people with autism, neurodevelopmental disorders, and we are attending to the needs of that family right now. They might be coping with behaviour that really challenges, and they might have got to that crisis point. And we give all sorts of practical things. It might be supportive phone calls with the parents, it might be parenting workshops, whatever it takes. And 100 families who described being in crisis when they reached our charity, only 6 felt that was still the case after 12 weeks accessing the services. Now, this is really good joint working with the statutory agencies, the commissioners and charitable providers, and crucially looking at the parent and the whole family in front of us and saying, how can we support you out of a crisis situation? So if we could see one of those, I think the Children's Commissioner's Office came and saw it, was really enthusiastic and said we need this everywhere, frankly. So there are some relatively low-cost interventions that can make a real difference in communities.
And what sort of resources does that hub then need access to in order to be able to do that? What expertise, what ability to call on others to help does it have in terms of that setup?
What makes a real difference is having, if you like, the kind of the mainstream workforce, you know, your GPs and your teachers, your sort of generalists have enough SEND knowledge, and then your SEND specialists who are working directly. We work a lot, we have fantastic parents with lived experience who are supporting other parents with their expertise. So that's what we really need in that local community. And also it's the positive attitudes, because all children are brilliantly unique, and what parents of disabled children they're fighting tooth and nail. They want to be getting on and having fun with their kids like we all do. They're battling the bureaucracy, and what they say is positive attitudes can make such a difference. We're here to support you, we're here to help you. So I think it's a real mix of things, but we know it can work when we've got that positive attitudes and the multi-agency working really being put into practice.
Okay. Tina, can I bring you on that? Any thoughts beyond that in terms of where the biggest bang for buck is in terms of early intervention?
I think it's about joint up working, as Katie says, but it's multi-agency approach. So often I have conversations with commissioners in local authority areas who say that they're struggling with numbers of children who've got EBSA, for instance, so that's emotionally based school avoidance, and they're looking at strategies. And that's fine, but actually this is not an educational issue, it is also a health issue, it is also social care, and we need that joint working approach. And as Katie said, it has to be led by the families. The families just really want strategies in order to understand their child. When you have a child, you can find handbooks all over the place for how to parent a newborn, for instance. But if you've got a child with a disability, or you think that your child has a disability, there is no handbooks for that. And there is no way of navigating the services. That is very, very complicated. And often people who work in those services are also struggling to figure out who needs to work with them at what point. And whilst we're talking all thresholds and they don't meet social care thresholds and all that, whilst that is all happening, and don't forget there is a huge amount of vacancies across social care as we talk about this. You know, families are getting worse and worse and worse and more. And unfortunately, until you get into crisis, that's often when the support comes in, and it's the wrong type of support. And actually, families need that support much earlier. And they need strategies on how to understand their, child with neurodiversity or any other condition that comes into play. And they don't get that. It's very much about safeguarding. And often safeguarding is an issue when it's too late. They need to get in much earlier.
Stephen, final point on that before I...
Yeah, I agree with both Katie and Tina. I'm bound to say I think more investment would be really important. We really welcomed the Short Breaks Innovation Fund, which came in before the implementation plan, and seeing that expanded would be really helpful. And then just sort of building on Tina's last point, I think assessment and looking at how assessments are done is really important. Look at the work of Luke Clements on institutionalising parental blame, Professor Luke Clements, where social workers are going into families where there is no evidence of abuse or evidence of safeguarding issues, but they're going in and doing the same sort of assessment with the same assessment forms as they would where there's a family where there were concerns about neglect or abuse, and that's stigmatising and inappropriate for families who are looking for support.
Is there a challenge here, and we're doing it to a certain extent with this inquiry, but is there a challenge with lumping disabled children's social care in with all other forms of social care? That's inevitably going to lead to that kind of challenge, or is there a conversation we should be having about labelling it differently?
Yes, I think there is. I think there is an issue there. I don't know what the answer is. I think my personal view is probably to separate, but I don't think that's not a Disabled Children's Partnership view. We don't. That is there are pros and cons. But that's why we welcomed the Law Commission review, and that's an issue they are looking at, and we were really pleased to see that as part of the plan.
Thank you. Can I bring Vicky in?
Thank you. It's absolutely wonderful to see all of you here today. Tina, it's absolutely lovely to see you on the screen. Can you speak loudly? Because I have learned that whenever Tina speaks, it's worth listening to the parent experience, especially. I want to talk about being able to access the services, but just quickly on what you've just said, Katie, about this course in Wakefield. If you were taking 100 families who all said they were in crisis before, and at the end of the course, 94 of them said they didn't feel in crisis, that's amazing. Who funded that?
So I'd have to check the exact details because the funding has changed over the course of time, but it's we've basically been working with local authorities and health agencies, but I'd be very happy to...
So it will have been state funded?
Oh, it was state funded,
okay.
Yes, yeah.
But really good, because what I wanted to ask, lots of families say that they're struggling to get respite care, they're struggling to get long-term care, they're struggling to get that sort of support and advice, and there is no textbook. Do you agree, and what do you think are the reasons? Is it because the pandemic created more need? So in which case, do we think this will come down, that we will see some children post-pandemic coming down, less need, or do we think that there's just going to be more need?
There's going to be more need. It is a good thing that we are getting more awareness as a society about differences. We're moving away from a one-size-fits-all lens on things. So there is going to be more need as we learn more about different disabilities and special educational needs. There's also more need because it's fantastic that more children are living now with complex needs than they've been able to, which is just brilliant. And yes, we are still picking up the pieces from COVID, and the glut of waiting list issues is partly related to that, but it was a problem before COVID. So I think the simple answer is need is going to go up. That is not a bad thing. It's about how as a society we meet each other's needs.
Any other comments on why it's so difficult to access services? Is there a postcode lottery?
I just want to make a kind of, if I can, just a quick comment on that pandemic point, because I think parents we speak to would not forgive me if I didn't. When we researched the pandemic and the impacts during and after, every time we spoke to parents, they made the point of saying the pandemic's made things worse, but yet it hasn't created these problems. And so the system was in crisis across education, health and social care before the pandemic. And we shouldn't just say it's because of the pandemic.
No, but it has amplified the need.
Yes, I mean...
I don't think... I
Kate,
don't think
Tina's going to say something.
Sorry, I don't think it has, Minister Ford. I think that the issue is that you've got a workforce that's got vacancies everywhere, and there is waiting lists. There were waiting lists before the pandemic. There are some families that are waiting for a diagnosis that have been waiting way before the pandemic and are still yet to be seen. And I think that, as Katie and Stephen have both said, I think, yes, there are some families that have been waiting since just before the pandemic and during, but actually the issues were there way before. Okay. And I think it's around making sure that there is that joined up working approach, which doesn't happen. And there is so many families that are waiting for a carer's assessment which doesn't come. Often they don't meet the criteria for a carer's assessment but are crying out for it, and yet then families end up in crisis because they're just waiting for that diagnosis. But we've got to be open and honest about that diagnosis, is that often it doesn't open any more doors to services. It just means that people understand what they're dealing with. So schools often are the ones that push families down the pathway to diagnosis, so they understand what they're dealing with, and it's the same for families, and families want that as well. But actually often what we then see, or the conversation we have with families, is that they've got the diagnosis for high functioning autism, for instance, but then that doesn't open doors for any more services. So I think it's about working together. It's about health working together with education working with social care, and it's that wraparound support. And often I have discussions around the whole school approach for children. It starts from the moment that child gets up to the moment that child goes to bed, and everything and anything in between. And so we can only do that if we all work together, including helping families with the right tools to be able to have strategies that work for their families, and that's really key. Is that they're, it's an open-ended conversation that actually everybody is part of.
Tina, hold on a second, because I know some of my colleagues are going to ask that question, and please call me Vicky. In particular, about access to short-term respite and long-term residential. Is there just not enough of it, or are there other barriers?
I don't even think it gets to that point of respite. I mean, it's about the things that happen beforehand. And yes, respite is a major issue. We were talking as a group earlier on this week around direct payments. Direct payments get offered, and yet families can't fulfil those direct payments because they can't get a direct payment worker to look after their young person, their child and young person. So whilst they might get money from the local government, actually they can't fulfil the need of that because no one's there to support the family. And if you've got
lots of barriers.
Yes, if you've got a younger child under the age of 8, often they can't do short break activities on their own because insurance doesn't cover them. There's a lack of activity providers for those short breaks. And then there's respite, which again, direct payment workers will only work with specific age groups. If you've got children that are younger or children that are slightly older, so those that are pre-teens, will often struggle with finding a worker that will support their families. So again, it's the families are really, really struggling, and yet there's not the facilities there to support. And with the best will in the, local areas are trying their best, but if they're not there to support, then it becomes a bit of a moot point, and it becomes very messy very quickly for these families.
I'd just like to move on to recruitment and retention. Do problems with, we hear that in a lot of sectors at the moment about issues to do with recruitment and retention. How are recruitment and retention issues, as well as the availability of placements, affecting disabled children? Getting support.
Yeah, absolutely. I mean, there's a workforce crisis affecting short breaks that we've heard about, but there are actually a number of workforce crises across other parts of the support system too. For example, the early years workforce is in crisis, and I've mentioned the fact that you are very unlikely, actually, if you have a disabled baby or toddler, to be able to access a nursery place or a childminder, which is a disgrace. That means you're less likely to be in childcare because you have a disability. And that is in part because the workforce with the SEND specialist knowledge and the resourcing isn't there for the confidence to be there in the nursery settings to be able to take a disabled child. So I think workforce issues are everywhere you look, really, and they're a big part of the picture.
Any other comments on recruitment, retention, other than early years?
Well, I think as Katie said, it's across the board. It's personal assistants, it's specialist staff like therapists, speech and language therapists, occupational therapists, educational psychologists. So there just is a crisis across the workforce.
And is it because there's more need? Because we know there are more people working in a lot of these sectors. So, okay, Tina's shaking her head. Go on, Tina.
I don't think it is. I think it's just purely it's almost like we're fighting fires all the time. So I think this was always there, even years before the pandemic. I don't think it's a case of there's more needs necessarily, but I think we're just thinking about it much later, so that the needs of those families become greater. I'm sure that Stephen and Katie might add to that.
But Tina, sorry.
I do think...
So what I mean is, we know there's more children with special educational needs and disabilities. The workforce has grown in a number of areas. It just hasn't kept up with the growth in number of children with needs. Is that correct? Or is the work...
I don't think there's enough people on the ground to deal with this.
Okay.
209 ed sites that are funded by the government each year is not enough. It needs to be at least double that, and also it's about staff retention. So ed sites, for instance, and this is just one element, ed sites leave the profession and go private because they can't do the non-statutory stuff, the nice stuff where they go in and support child much earlier on.
Can I bring Ian on this?
Do the statutory stuff.
I mean, the thing is, we know that there are vacancies across across the board, and that's been said. I think we need to quantify that. This is an evidence session for the Education Select Committee looking at children's social care. We need to quantify what those vacancies look like, what the numbers look like. So if you've got any information on that you may not have at hand today, but can supply us with, please do that. I think that is important. I think there is also an element of this in terms of, we know that there are vacant posts. Now, if there are vacant posts, that implies that the resources there to employ those people. But it might be that there's vacant posts, but not the resource there to employ additional people who are also needed. So if we've got anything to evidence that and quantify that as well, that would be extremely useful, because, we could magic some additional qualified professional bodies out of thin air and say, well, here are the people that you need. But would the resource be there within the organisations concerned in order to employ those people to put them to work? That's an important question as well. And I think there is one other aspect about, and it's slightly going back to the previous set of questions. When we're looking at social care for children, we're looking at social care for families. And I'm really concerned about, is there good enough liaison between children's social care and adult social care to make sure that the whole family is being looked after in a cohesive way?
Sorry, can I go back and just finish? Ian, I agree with you about wanting the data. You'd come forward with which particular areas you'd like us to look at where there are shortfalls, okay? I do want to complete the questions that I'm asking here, and I'm sticking very closely to the questions that we've allocated. Okay? Many I could answer. Now, what I'd like to know from you is what more you would like the government to do. We know the government is now paying for funding for 400 more ed psychs to be trained. You mentioned early years. I met somebody recently who was going through the early years SEND training and thought it was fantastic. What more actions would you like the government to do?
Yeah, if I jump in, yeah. The first thing is to have the political will and the leadership, at the top of the government and across the government, that is prioritising disabled children's support and care. And we want to see, as part of that, a Minister for SEND with cross-cutting clout and accountability, and to really drive that joint working of education, care, and the social side, and all those different aspects, because we're talking about children and family members who interact with lots of
How's that different from the Children's Minister, Katie?
Well, that is held at a junior level. We need to have seniority in this. If we think something's important, we should treat it in that way. We were delighted to welcome the Prime Minister to one of our inclusive nurseries, and that was fantastic to have that engagement. Well, that needs to be translated into accountability and top-level
You'd like
leadership.
the Children's Minister to be a Minister of State?
Yes.
Okay,
Yeah.
we can definitely make that recommendation. But are there other specific actions you'd like us to
Can I just comment on that? It's not just about being a Minister of State, it's also having proper purchase across authorities, across government departments.
Okay.
So, the role of getting health to the table is something that is consistently, further.
We're going to need to make some progress, Vicky, because
yes.
That's
well
always
over
been an
spent.
issue.
Well, maybe you'll come in on some of the others if you think about it, but that specific question about what you want the government to do.
And resourcing across departments, I think, is important. Mohammed, can I bring you in?
Yeah, thank you so much. We all understand that disabled children's social care is under huge pressure. How this pressure is impacting parent carers? Can I come to you first, Tina?
Yeah, sorry, can you repeat the question again, Mohammed? Sorry.
Well, we all understand that the disabled children's social care sector is under huge pressure. And how this pressure is impacting the parents who care for the children?
Thank you. So I think that it's pressurising the parents an awful lot. I know of lots of parents who ask for a carer's assessment because they're struggling to meet the child's needs. They're struggling on many levels, including on how to maintain work, which I'm sure we'll touch on in a second. But actually they get turned away for carer's assessments. And actually, it's a fundamental right that actually, if they care for a child with additional needs, they should be having access to carers assessments. And that doesn't happen across the board. It is a bit of a postcode lottery, and it's also a bit about relationships as well and getting to know the families. And often that doesn't happen either. And so it's left families thinking, well, where do I go? Where do I go for help and support? Parent carer forums, of which there is 153 of them, struggling with capacity and actually trying to figure out how best to deal with the health and well-being of their members. And it becomes a real issue of something that we've discussed at length over the many years that I've been part of our organisation. And just for families just don't know where to turn. And often they'll get pointed down pathways, they'll get pointed down CAMs, and all of which have criteria that need to be met, all of which have huge waiting lists. And sometimes they'll get bounced around the system. So they will go to somebody for help. They don't meet the criteria, so then they get bounced somewhere else. They don't meet the criteria there, they get bounced somewhere else, and it's the wrong place or the wrong door. And they have to retell their story all the time that they go through these doors, and it becomes a real nightmare for them. And like I said, trying to maintain all of that whilst they're trying to work is difficult. And then sometimes they get carers allowance if they apply for DLA, which also is a struggle to apply for. It's not easy. And then they're in that remit of only earning so much money per week. Otherwise the carers get taken away. And then there's issues around other benefits like universal credit and other things. And it's just a minefield for families to try and sort out. Claire Coutinho, MP, came to our conference a year ago, actually, and she said that her constituents come to her with issues around SEND, and the information that they carry around can be weighed in kilos. That gives a good testament to what families face every day, that they have to literally be almost like a bookkeeper, accountant, admin for their family, and the evidence that they have to keep and provide literally can be weighed in kilos. It's a massive undertaking, and it's a real struggle, and families do struggle with that, and it affects their mental health, it affects their general health. They often put themselves second, and then they have lots of underlying health conditions which can be quite serious and an issue to a family that they're ultimately the main care is not being cared for.
Many of those parents who provide care to their disabled children have to leave their jobs. So yes. What are the consequences of for these families?
Living in debt and deprivation, in all honesty. The amount of families that we speak to that have got a growing debt, it costs a lot to have a disabled child in additional equipment, heating, and sometimes they don't know about the benefit system. We work very closely with an organisation called Contact, which Stephen also works with, and Katie. They provide a helpline that's free for families, and overwhelmingly the most things that get talked about is benefits, because they can't maintain their work life, which is also their social life. It has to be said, to work often isn't just about money, it's about going out somewhere, talking about other things other than their children, and having to deal with other things other than their families. And sometimes that is their respite, that's all they get. And it's not great for their health and well-being if they can't work either.
So how could they be better supported to enable them to carry on their work?
Well, interestingly, if you've got DP, so if you've got direct payments, you can't use it towards childcare. So you can't employ a direct payment worker often. I'm sure it's not the same for all local authorities, because each local authority has different rules. But actually, you're not supposed to use that worker as being able to go off and work. That is you being at home and having time away from your child, and that worker will then utilise the monies paid to take them on activities or do something within the house, or do post-16 things, preparing for adulthood. I think that more can be done to support families to live a life. It's not even a normal life, it's a life. And I think that is very, very tricky for our families. and more needs to be done to support the family about what they want to do and how best to fulfil them and to make them feel like they're other than a carer. Everybody is an individual, and yet it seems that the more that they care for their families, which is a natural thing to do. I'm a parent carer. I have a child with additional needs. I care for my son, but actually I'm here and I've got an identity, but a lot of families aren't that lucky and do not have an identity of their own, and it's a real issue.
Okay, any more comments from?
I just add, what we need is the childcare system and the benefits system and employers to be working together flexibly enough to enable parents of disabled children to go to work. The other point is the economy is losing out on the talents, which are numerous, of parents of disabled children. They bring huge skill in navigating systems, a lot of medical expertise alongside other professional skills. So I think that's what needs to happen, and this is where the expansion of childcare, which is welcome, has to mean an expansion in places for every disabled baby and toddler.
And I just want to add on to Katie's, when we say expanding childcare, we do mean into primary and secondary school levels. Often childcare is for younger children, but actually we need to expand that, and often after school clubs, which are available, are not available to those children with additional needs. It's a real struggle, and I do think as well, it's doing the government a disservice. Lots of families end up on benefits, which is not where they want to be. They have no choice, and as such, they're earning less money and have left probably really good jobs, or jobs that would give them a sense of well-being and a sense of self. And actually, the government needs to work more closely, as Katie says, across the piece in order to support these families, because otherwise they will end up on the benefit system because they've got no choice to do so.
So if I move on to next question, many parents of disabled children responded to the independent review of children's social care, expressing concerns about the experience when they tried to get help for their children. Parents said that there was often a focus on safeguarding during assessments rather than on the child's disability-related needs. Do you agree with this, Katie?
Yeah.
Yes, I do. We hear this time and again from parents, and what we want to see is a lens of risk and need rather than assumption, as Stephen said earlier, that there is a safeguarding issue there. Safety must come first, but the lens through which we look at this should be support, first of all.
You want to come in?
Yeah, very much so. This is what families tell us all the time, that they are blamed. They're not supported, they're blamed. It's their fault, their child. Needs aren't being met. The expectations on parents. I was talking to a parent last week, a parent whose son tragically died. It was the anniversary of his death on Friday. She said when he was in school, he had 3-to-1 support, but when he was at home, she was on her own, but she was blamed for not being able to support him. And yet, in other circumstances, people recognised they needed more support, and yet that support wasn't available to her at home. So I think that really is a specific case which shows how the whole perception of how parents are viewed by the system doesn't recognise their reality and comes from a lens of safeguarding and a lens of blame.
So evidence has reported that the parents with learning difficulties are 55% more likely to have their children taken into the into the care than other parents. So do you think that these parents are reluctant, or they don't report the issues early enough, because early intervention is very important?
Did you say disabled parents in the first?
Learning difficulties, with the learning difficulties, yes.
Yeah, so we're not set up, we're there very much to support disabled children and young people, so this isn't a specific area of our expertise in terms of working specifically with disabled adults and parents.
Tina, did you hear my question, and have you got any view on this?
Yeah, so did you say disabled children?
I said the parents with the learning difficulties.
Right, okay.
So they are 54 times more likely to have their children taken into the care than the other parents. And they, there's thought that everything may not be reported early enough, the difficulties that disabled children are facing.
This goes back to Ian's point about the join-up between adult social care and children's social care as well.
If they've got a learning disability, then they may be known to adult social care. If they've got a learning difficulty, so anything that's dyspraxic, dyslexia, that's a learning difficulty. So there's a difference between language here. And actually they may not be known to adult social care. I think there's several elements for me for this. Is that one is that some families are scared to get social care involved because actually it's around safeguarding and they know this and there's a reputation around that. So ultimately they're worried from the off that their child will be taken away from them. Secondly, it's often a case of actually families don't know where to go. And when they do, they get turned away. And it goes back to that point we said much earlier on, is actually families are left going to crisis because they don't meet criteria elsewhere. And so it is definitely much earlier that we need to get in, but also for social care to actually care, because it tends to be around safeguarding rather than caring and figuring out what that family needs to survive, to operate smoothly and correctly. And often what happens first is it becomes a safeguarding risk assessment first before then support is put into place. And I get that we need to be careful because of cases of children who have died very much recently around, during COVID, where we had Star and Arthur and all those children. We get that. But actually you do need to take a wide lens view on families, and sometimes as well they'll go in and they'll do a key piece of work for much less, a lower tier in social care, so like tier 2, which is much lower, but they'll only work with a family for 6 weeks, and then they think that everything is hunky-dory. After 6 weeks they leave, and then the skill set's not embedded at that point, and so they have to go back in. And if you've got an adult parent with a learning difficulty, it might take a little bit longer for that information to be retained.
So what help those parents need? So how we can better support those parents while their children are getting...
it's a joined-up working approach, Mohammed, at the end of the day. The services do not work together. It's very much in silos. Children's social care often do not talk to adult social care. The amount of families that don't need children's social care throughout their entire time and the child reaches adults and they're suddenly known to adult services is massive. So why don't social care talk to each other? And often they have different computer systems within a local authority area. So the two systems don't even talk together, they don't match, the information is not freely available, and then we're also not involved in health, and we really do need to involve all agencies, so education, health and social care together. It's the only way that we can do this.
I'm being Flick, thank you.
Thank you, Robin. Going on to personal budgets, and we've sort of heard a little bit about direct payments. I think, Stephen, in your submission, they stated that they're good things, so I think, and contacted as well, although I think they are insufficient to meet costs. So I just wanted to know a little bit more about your feelings about direct payments.
Yeah, I mean, I think, as I say, I think in principle, direct payments are a good thing, giving families control and choice and flexibility on how to support their children and their family. I think there are three things that need to be in place for them to work. One, they need to be sufficient. Two, there needs to be the provision to buy. So there's not a lot of point in getting a personal budget to employ a personal assistant if there's no personal assistance that you can employ. And thirdly, they need to be flexible. If you're given a personal budget, but the local authority puts really strong constraints around how you can spend it, well, and claws it back if you don't use it in the right way, there's not a lot of point in having had the flexibility that a personal budget gives you. So I think they're a good thing, but those things need to be in place.
And how common is it then that they put restrictions on the local authorities put restrictions? And can you just explain what sort of restrictions they would be?
Well, I think it is, is it sort of very, very straitjacketed? This is a personal budget which you must spend on X.
Right, okay.
Or how much, and sometimes, particularly when there's a case of, you can't employ, there isn't a personal assistant available, but there might be another option you could use that money for. But the response from the local authority is, no, this was for a personal assistant, so you can't spend it on a day out, which will give you a break in a different way, or whatever. I mean, I haven't got stats to sort of quantify that, but that's the kind of anecdote and stories that we hear from parents, and Tina and Katie may have more to add.
There was more flexibility during COVID, and we would like the government to look at reintroducing that level of flexibility so that families can get that support in place. Also, they're not for everybody. Some families tell us they feel pushed towards that. They don't actually want to be an employer. So we need flexibility kind of within the system and then without, if you like, as well. They're not right for everybody.
Tina, from a pet care.
I agree with Katie and Stephen's point. So during COVID, for instance, you couldn't go out with your PA, so monies were being sort of saved, if you like, and families were getting a little bit frustrated and worried about the clawing back of those monies and not having the time and the respite. So local authorities were quite flexible in their approach. So you could buy a trampoline for your garden, for instance, so the person could go for a bounce and wear off some energy and feel safe in doing it in their own homes. That stopped as soon as COVID was finished, and hiring a PA is quite difficult, or a direct payment worker. And as Katie's alluded to as well, being an employer, so having liability insurance, actually paying tax and insurance and national insurance for your worker is really, really difficult. And touching on Mohammed's point, if you've got somebody who's got a learning difficulty, that can be even more of a minefield for families to follow. And even when you use a third party, like the local authorities sometimes offer, to pay these workers through, the system itself can be very, very complicated. And you think it'd be more simple, and families do often get in a mess and feel actually it's not worth claiming for, because actually the worry of not paying somebody the right amount of tax or not having the right amount of money in their account to pay somebody is a bit nerve-wracking for some families. So it needs to be a flexible system that is simple to follow. And again, it goes back to my point of a parent being an accountant, a financial advisor, an employer, and also navigating other systems. It's just really, really complicated to do.
Okay. Does it normally cover the support that they need, or is it very clear that it's not covering the amount? I mean, do local authorities do they restrict the amount you're getting, or do you get enough for the support you need?
I think it can vary. It can vary depending on what the agreement is.
Okay.
But often they will give a set amount of money, but that might not cover a lot of hours. It depends on how much an hour the DP worker or PA is offering. And like I said, there's not many around that will do that kind of work anyway. They're very few and far between.
And are they easy to access? Do all local authorities have a clear pathway if you want to have a direct payment type scheme?
So it's a variable picture, as with so many
Just
other
variable
bits.
again, okay. So there's no standard across the country. It's just
No.
the local authorities decide what they're going to do.
And I think, like all parts of the system, it can be very difficult for parents to navigate, and the availability of information and that support. And
Thank you.
And often to get a DP worker, you have to have a care assessment, and often that doesn't happen. So again, you've got lots of families who might want this, but don't meet the thresholds for a care assessment.
Okay. Thank
You mentioned clawbacks. Post-COVID, has that been a big issue for families in terms of amounts which may have been stored up and then threatened to be clawed back? Or have councils generally taken a pragmatic approach to that?
I don't think we've got a complete picture. I think it's another varied postcode lottery kind of issue where some councils have been more draconian than others.
I mean, I've had some casework on it and have generally found when I've taken issues up on that front that the local authority has been reasonable in its response, but it's certainly something that I would want them to be able to show that support for families wherever possible.
And I think, again, anecdotally, I think sometimes that's what's happened. The initial response is kind of commuter says no, give us the money back, and then there's more flexibility when pushed. But parents really shouldn't be having to battle like that. And if you don't, how many pay back without knowing because they don't complain.
Yeah. Thank you, Nick.
Thank you. Ofsted currently inspects disabled children's care through local authority children's service inspections, the social care common inspection framework, and through local area SEND inspections. I know we will be speaking with the National Director of Regulation and Social Care from Ofsted later, but what is your assessment of the value of Ofsted's inspections for disabled children's social care?
I think my impression is that the children's services inspections often don't focus strongly on disabled children and leave it to the joint area inspections. And I'm very concerned about examples where there is a real disconnect between the two. So in 2022, Kent's children's services were inspected in May. They were found to be outstanding, and yet in September, Ofsted and CQC went back in for a follow-up visit after their previous local area inspections and found that insufficient progress had been made on the action points from that previous local area inspection. So we have the same authority being told it's outstanding and effectively told it's failing at the same time. So I think there's a disconnect between the two that's concerning.
How does that happen?
Well, I think it is, as I say, because I don't think the children's services inspections have a strong enough focus on disabled children, because I think that's left to the local area inspections, which I don't know if this is fair or not, but to me don't feel as high stakes for the local authority as the children's services inspection.
Can I just add that short breaks in the community aren't regulated at the moment, or regulated in a similar fashion as to other services such as care in the home, even though short breaks can be very high risk services to run. So that is just something that we would like to be looked at with Ofsted and others as part of a holistic look at the inspection regime.
Do you think providers of short breaks would welcome that, or do you think there's a mix in terms of whether because a lot of those are quite small providers, so is that a conversation which is going on within that sector?
I don't know if it's a conversation that's going on. I mean, the fundamental problem with short breaks is they are in very short supply. My charity is withdrawing from short breaks all over the show because the local authority can't pay the price to run a safe short break. So that's the more fundamental problem rather than the regulation and inspection of them. I just think it's a conversation worth having so that we're being consistent about these things when we're running services that do have risk and need in them. I think it's important that they're regulated and inspected consistently. So I think it will be about how we have that conversation and how we could be proportionate about it. But there's a more fundamental issue at heart here, which is whether we're going to have any short breaks left at all.
And we pay for them fundamentally. Yeah. Thank you.
Ina, would you like to add anything to that?
No, I think Katie, as and Stephen have said it beautifully, I do think, the fundamental issues that we've not got enough short breaks nationally, and those with the innovative fund are doing really well, but it's just not enough, and we need to go much wider. And often when Stephen was very helpful and Katie shared this on Twitter, one of the things that came back was around short breaks, and that there isn't any unless you're part of an innovation fund, and families are really, really struggling just with the basics, and that is a basics that's often a much lower threshold than direct payments. And if families without direct payments can't access short breaks, then we know we've got an issue.
Just with later, the next panel and the committee will be raising Hesley Group and what's happened there. There's obviously huge concerns, and there's a police investigation going on. There's they're just absolutely terrible things that have said that have happened. They're just unbelievable that any individual could do that. One of the main issues that I've come across, because they are in my patch, is the fact that children are being placed away from home, and so obviously it's a lot more difficult for parents and carers to actually get to see their child. Other than the abuse that has happened there, which we all agree is terrible, what other issues are there with regards to placing children away from home? Because I think one of the children there was 94 miles away from home, which is it's extreme. Not everybody's got a car. In fact, many people have not got a car, so this is really difficult. So what other issues are there with regards to placing children so far away from home, and what can be done about it?
Absolutely. I mean, I'm not a provider of residential services, but the thing I would just like to say is that we should have this ambition and commitment for all children, wherever possible, to be part of their local community and their home life. That's what we want for all children, and why would that be any different for a child with a disability or a special educational need? That should just simply be their right. So we just simply want to see all the legislation and the policy and the resourcing, all the working together that can make that a reality for every child.
Would you like to add anything, Stephen?
I mean, I absolutely agree with what Katie just said. I think fewer children should be in these kind of institutions because there should be better support in the community. All of the things we've talked about, the access to short breaks, access to other support, early intervention, so that children can stay in their family homes with the right support around them. As I said, that sort of seems to be an unwillingness to put support into families' homes, rather wait for the family to fail and then take the child into an institution which costs more and produces worse outcomes.
It has less visibility if it's further away.
Yeah,
we just talked about Ofsted inspections. It's very difficult for them to inspect what is going on with the children who are out of area when it comes to a local area inspection and that side of things as well. So about visibility is reduced. Tina?
I think I want to echo both Katie and Stephen's points. I think fundamentally it's around early help and early intervention support. And actually, most families do not want their child to live out of home or away from them, and neither do the children and young people, most importantly. I think there has been some large pieces of work in regards to LDAs, or learning disability and autism, around admission avoidance and making sure that actually interventions, and if they do need to leave home and be away from home and be either in a mental health inpatient bed or not, that actually it's about being closer to home and being around in their communities. But often as well, families don't understand or know what support can be put in place first and have those discussions either. It is a minefield when you have a child with additional needs that is very complex, may have challenging behaviour, and they do not know where to go. And if they've been turned away or gone down a rabbit hole and actually put in the wrong place, actually that can be catastrophic. And so often they'll just struggle to the point that it gets to crisis, and then the only option is to be in a residential setting. More work needs to be done to support those families, those children, young people, to make sure that the decisions that are made are in the best interest of all, and actually that support can be put into place much earlier on, and that will then hopefully stop or have fewer residential setting placements because of that.
Can I just briefly ask, what happened at Hesley? We all agree was terrible, but it was previously rated good. So what value would you put on these Ofsted? On these Ofsted results when this is happening and they are being rated as good?
Yeah, I mean,
often the re-inspections are not happening soon enough. So if you get a good rating, it could be quite a few years before they go back in and reassess and visit a setting, and more needs to be done around that.
Yeah, I mean, I woke up this morning to a story on the BBC News website about some horrific abuse in a special school in London, and I think I'm right in saying that school had been rated either good or outstanding previously, so there are clearly issues, but I don't have an easy answer.
Would you like to add anything?
Thank you, Nick. Ian?
Right, Stephen, 3 years ago your organisation reported an annual funding gap of £573 million for disabled children's care. How is the situation now compared to then?
We haven't reassessed it, but I find it hard to believe it hasn't got worse, to be honest. That 573 million figure was actually an updating of our the original research we commissioned in 2018, which had found the gap at 434 million. So in that 3-year period, it had risen by 140 million broadly. So I don't really see any prospects of it gone
now
anywhere.
713 million.
Yeah, possibly. I mean, I wouldn't want to put a figure on it because we haven't done the work, but it's still a very large figure. Yeah.
I mean, look, you know, I think since 2021 there's been quite a number of things happening, but one of them has been rampant inflation, amongst other things. And you know, has there been anything in your assessment that would improve anything, even in a slight way?
I mean, as I said before, we really welcomed the Short Breaks Innovation Fund, which was something we'd called for, and we were really pleased to see the government bring that in. And that's starting to impact where it is happening. Yeah. And what we really hope is it brings evidence to show that actually just filling the gap has long-term economic gain. So it's not just a funding black hole to just pour money down, but actually it will save the public sector money in the long term. So it is an investor save.
I mean, even with the Short Breaks Innovation Fund, I mean that sounds great in principle, but if you used to have a capacity in a locality to provide respite, and then that evaporated for whatever reason, due to cuts or whatever, you can't reinvent that overnight. That's the trouble. That capacity has gone, and then recreating that capacity becomes extremely difficult. So the fund might be there, but are the places there in order to access the fund?
I think that's right. It'd be nice to get the funding there to find out, but but I think those projects in the Short Breaks Innovation Fund, as I understand, are moving well. So
okay, and from your perspective, Tina and Katie, I mean, have things improved or has things got worse?
No, things have got worse. As I said, families are on multiple waiting lists, and I'm a charitable provider of services, and I am exiting from services for disabled children that are a lifeline because the local authority cannot pay the price for me to safely deliver the services. Sometimes another provider will come in, great. Sometimes nobody comes in to deliver the service and the local authority has to figure out what to do next. So that's why we have deserts around the country where families can get nothing. Postcode lottery is an overused word, but it is genuinely what we have when it comes to disabled children's care and support.
We'll have deserts, we'll have lotteries, we'll have hot spots and not spots.
Sadly, yes.
Okay, thank you.
I mean, I'm based in the southwest, and out of 15 local authority areas, 2 are not under any DBB or safety valve funding issues. So those that are with the deficit budgets are either in DBB or safety valve, and out of 15 local areas in the southwest, 2 are not part of those programmes. That is a clear indication that there is money issues in the system, and there is growing number of local authorities that are going bankrupt to filing their Section 114 or at least talking about it. That to me is speaking volumes that the here and now is that lots of local authorities are struggling to meet needs.
Can I bring Caroline in on this point about short breaks and provision, because I think you wanted to do a read across to other areas.
Thank you, Chair. Even shorter break, holiday activity food programme, so just generally for a session or for a day. I've been a big champion of them. I've seen the difference that they can make for both the children and the parents in all sorts of different ways. And very fortunate that we have one particularly successful but oversubscribed programme in my constituency of Eastbourne, which is run expressly for children with additional needs. Back to our not spots and deserts. Do you have a sense of how this programme is working for children and families with those additional needs across the country?
I mean, I've got some great, this is the HAF funding, is it? That you're, yes, I've got some great examples where we've been able to dive in and run holiday programmes. I was at one at Easter myself for disabled children with special educational needs and their families, and siblings have been able to come to some of those as well, which is superb. And what they've been saying to me is, this is amazing because this is the only thing I'm doing with my family this holiday. That is the impact, and where local authorities are being agile, they're allowing us to do that good work with the food side of it, but actually alongside lots of other activities as well. So it's just a really, truly inclusive activity programme. But again, those will be few and far between, and we will now be sort of struggling to look at how we can do that and replicate it, because unfortunately funding pots come and go. And I think that the central message for me is, every child should be able to access holiday activities. If you're disabled, you're very unlikely to be able to access so-called inclusive or mainstream provision, particularly if you've got quite complex needs. And that's why that sort of programme that we put on, you get that kind of message coming back, this is the only thing, or it might just be a day in the week I can access that. So I think again, it's a good example of where the whole system needs looking at, particularly where you look at the long summer holiday and the devastating impact that can have when there's nothing for your disabled child or your family.
The learning loss then as well that can represent ahead of the September return.
Do you know anything to add on that before I come back to Ian?
No, we're not a provider, but we do. I echo exactly what Katie says. The feedback from families is it's very challenging and very difficult to access, and funding pots are few and far between, and they will have a set amount of money to disseminate amongst. I think sometimes the bids that come into local authorities to fund these initiatives, they are usually there's lots. And trying to divvy out the money fairly and to provide for most children is high on the agenda, but the funding pots are getting smaller.
And I have to say, in my local area, we've got a fantastic HAF provider who is focused on children with special educational needs. They've just seen their numbers of children they can support cut because of the need to provide support more evenly across the county. But it's incredibly frustrating when you know that they're doing a really good job. And that is one that I think it's really important we support both the mainstream HAF but also that specialist support. But Ian, bring you back to the final question.
Yeah. Should there be a clearer demarcation line between social care for disabled children and the rest of children in social care?
I mean, I think we touched on this earlier. I think it's a balanced question. I think my personal view is yes, there should. I don't think that's necessarily the view of, that isn't a organisational view because we haven't taken one. I think we were really pleased to see the independent review take up our suggestion there should be a law commission review. That's going on. We think that's the right place to try and answer that question. But I think, there's definitely, if children's social care really delivered section 17 as it should do, as about support rather than, supporting families, then there shouldn't need to be a demarcation. But that's not the reality, and I think that pushes towards one.
Anyone else on that?
Tina was nodding along to that, I think.
I was nodding. I think it's a really, really tough question and something that the Law Commission should definitely look into as part of their consultation. But I do think that the two departments and adult social care really do need to talk to each other. That is not happening. And if you go down into one social care, so the mainstream social care, and you go down a safeguarding route when actually you need support, then it needs to the children's with disability teams, social care need to come in much quicker, much sooner.
I mean, I'm asking a hypothetical question, but from your assessment in what you've just said in that case, is it too early to say how this would work in practice?
Yeah, I think so. I mean, the Law Commission been doing really good engagement with people. Everyone I've spoken to has been really impressed with the team and how they're working. We're expecting their proposals later this year. I think we'll all want to see look very closely what they come up with.
Yeah. And the answer that Tina's just given kind of almost answers my next question, which was how would you assess the efficacy of multi-agency working within children's social care? Because it's quite clear that some elements don't necessarily work well together with each other to support the whole family.
And I do think advocacy services play a part in that as well. To get, Mohammed touched on the parents with a learning difficulty. All parents struggle to navigate through the system. Advocacy is really, really important that we hear, not just from the child and young person, but the families themselves. And I do think it's a very, very complicated system that actually needs to be simpler and it needs to be multi-agency. I'm sure Stephen and Katie have got something to add.
I just can't help thinking myself, as a member of Parliament and having been a councillor for quite a number of years, that some families will have things done to them and some families will be in a proper negotiation about how they work with the system, and I think it's quite clear inherent unfairness within that.
It's completely right, and our solution to that is we've trialled a navigator service, a community navigator. This is a named professional who works hand in glove with the family with excellent results, and in a sense that person enables multi-agency working. It's like having sort of a hub and spokes, and they're supporting that family member to get that childcare place, to get in with a parent support group and to work with all those agencies. So I think we need to look at it from the family perspective and elsewhere. But we would love the committee to recommend that the government embraces that pilot of a navigator and see if that community model could be part of the solution.
Where has that been done?
In Birmingham,
Okay.
and we'd be very pleased to share the results with the committee.
Thank you very much. Thank you. I will ask you to give up your places for the second panel. Thank you very much for your evidence today.
The proceeding is currently suspended. 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 The proceeding is currently suspended.
To us today. The second panel consists of Annie Hudson, the chair of the Child Safeguarding Practice Review Panel, Professor Michelle McManus, Professor of Safeguarding and Violence Prevention at Manchester Metropolitan University, and Yvette Stanley, the National Director for Social Care at Ofsted. Can I ask first across the panel, really, what are the main pressures facing the various safeguarding systems in England, and how would you rate the government responses to them so far? And perhaps with touching on that, looking at issues of workforce recruitment and retention and how that affects quality. Michelle, I see you nodding on that second point. Do you want to come in first?
Very big question. Thank you very much for the invite for today. When we're talking about pressures, I think a lot has been mentioned in the previous session as well and in ones beforehand. Which is about the complexity. We've got a really good mantra of safeguarding is everyone's responsibility. What we seem to have an issue with is moving that from the individual and the practitioner to a sharing that is a collective that allows us to be able to understand whether our safeguarding arrangements are effective. And there's lots of progress, certainly, that's being made by government, lots of great policy that's obviously coming through stable homes, and we've got the National Social Care Dashboard as well that's making some real progress about how we're going to measure that. So from our evidence, it is about the pressure is on the understanding of that individual that they're working with. We've talked previously in the other panels as well about the child's voice, and I think you've heard it just in that session, the difficulties with certain cohorts of really trying to understand that lived experience. And that's one key element of that. But to be able to understand that lived experience, the daily life for that child and their circumstances, it requires a really functional, effective workforce at an individual level to take that individual responsibility. But it's not just one sector, not just one agency. It's about how we're pulling in everyone. And it is about how do we effectively measure that? How do we become reassured at that, both from our strategic level, from the safeguarding partnership, from some of these teams, but also on the ground? And I think that is probably one of the biggest pressures. And there's so much to say there about our workforce in terms of, competencies, the confidence, the clarity of their roles, what is in their remit. We've got so many different sectors with their own policies. And importantly, the capacity. The fact that we're having to have discussions about CSA mandatory reporting is telling us there's something really fundamentally wrong with our workforce, that we're having to try and push something like that to allow our workforce to be able to report concerns about children. So they're kind of the big things. There's lots more to say about that, but systems and processes, and then I would say around about, which has been talked about, which is early intervention. Yeah. What do we mean by early intervention?
You're in the business of training people, preparing people for this. But surely one of the key challenges as well is keeping people long enough that they can build up their professional experience and understanding of good practice. And that certainly, I guess, in my experience of concerns that are raised about social care and safeguarding, it's often the fact that it's a high turnover of people, which is part of the challenge.
Yeah, and we've seen that across the sectors as well. The great thing about having such rich data and experience of working across various areas with our safeguarding partnerships from that strategic level to the ground is telling us, as we've heard from other panels, that we're seeing that retention issue, that real experience across all those safeguarding partners. So it's not just on one sector. So when we talk about some of the initiatives and policies around how we can make our leaders and have certain qualifications and reassurance and minimal standards for our social workers after 3 to 5 years, for example, we need to get them through to that 3 to 5 years. So we really need to be understanding what we're doing with our workforce to really allow them to have that capacity and confidence to be able to be the eyes and ears of the children that they're dealing with.
Yeah.
Thank you. So in terms of pressures, I think, and we've heard this morning in terms of children with disabilities, I think there is evidence that there is increasing need, particularly children who've got quite complex needs. You've heard this morning about the kind of impact of the pandemic. We know that the numbers of children who are not regularly attending school has gone up, and that's been maintained since the pandemic. In the incidents that the panel looks at, which are always the most serious incidents where children have died or been seriously harmed, in our last annual report we noted that something like 50% of the children who we were considering had either not been in education or not been regularly attended. So they're kind of out of sight of school and the protective capacity that school can bring. We know as well that there are increasing numbers of children with significant mental health needs, and yet the services that can help them and support them and their families are often not available. They have to wait a very long time. We heard, for example, last week of children having to wait 2 or 3 years for a speech and language assessment. So all those factors are kind of compounding and exacerbating the kind of sort of need, and for some children, the risks that they're facing. So that's one extraordinary pressure on the system, and at the same time, the availability of some of those early interventions is just not there in the way that it used to be. In terms of the workforce, there's obviously a lot of attention, and particularly this committee will be concerned about recruitment and retention of social workers, and particularly the high use of agency social workers. Now, hopefully, that high use of agency social workers in some parts of the country in particular is beginning to reduce, but I think we need to wait and see whether that is the case. But what that means is that, that kind of churn of social workers and families having too many social workers. So each time they have to tell their story again, and the social workers and other agencies are not having a really clear and good picture of children, particularly when they may be at risk of harm. We had one instance recently where a family, a child, had 18 social workers during a course of 19 months. Now, that's a very extreme example, but I think it kind of brings to kind of into sharp relief the importance of children having people that they can relate to, that they can trust, that they can talk to about what's going on in their lives. The third kind of significant pressure, I think that there are issues, and we set this out in kind of quite extensive detail in our report on child protection in England about the tragic deaths of Arthur and Star a couple of years ago, that the design of the system, the multi-agency system, is problematic. It still kind of creates silos for decision-making, different families having different professionals from different agencies, health, local authority, schools, others, who are assessing their needs. So you get silo assessment, silo decision-making, and that means that the timely decision-making, the robust decision-making that you need, particularly when children are at risk of significant harm, too often doesn't happen in the kind of to the quality that there is. And that's why we made a very strong recommendation that of the need to trial and test multi-agency child protection teams, bringing people together in one team rather than the kind of passing of information around, so people can have a much more coherent and full and accurate picture of what's happening to children, particularly this very high-risk group of children.
That sounds brilliant. Is there a resource available to allow for that to happen? Because that requires a lot of people's time to work on those teams.
Yes, so what we're pleased is that in the government's Pathfinder programme, there are 3 already up and running and there's 7 who've been recently announced, that part of that Pathfinder programme specification is about trial and testing multi-agency child protection teams. Now, in our view, and obviously this needs to be tested, that does not or should not require additional resource. What you are doing is bringing together police, colleagues from health, colleagues from local authority children's services, bringing them together so that they're actually working as one team rather in that kind of siloed, sometimes quite fragmented way. Of course, there is a resource consequence implication in terms of setting that new design up, but it absolutely, in the end, should be more effective and more efficient, because you're not spending lots and lots of time moving information around and sharing that information. So we're pleased that that Pathfinder programme is up and going. We think that there needs to be more pace and momentum to that programme, because just since we produced that report 2 years ago, the panel meets every fortnight and we look at probably about 30 or 40 reviews of children where they've been harmed or died. And that pattern of fragmented decision-making recurs again and again. Yeah.
Thank you. And, I think this preempted Ian's question neatly there, but Yvette, can I just come to you in terms of, obviously you look across the piece as Ofsted in this respect. Do you see the same picture in terms of the challenges and the pressures? And what are you seeing now in terms of the picture of the workforce and retention there? Taking Annie's point about hoping to see an improvement in the use of agency workers and that sort of thing. Is that something that you measure?
So absolutely. I think looking across our inspections, we would see those pressures of demand, which others have eloquently talked about. I think there is, over and above the pressures of the financial situations, the stresses on families, the complexity of needs, there's been good policy decision-making across government. For example, we don't want children in inpatient mental health care. We don't want children in the criminal justice system. Those things have also moved children into the social care space, adding to that complexity. And absolutely endorsing what Annie said about where we see the partnerships coming together to take good, focused decision-making, that needs to have an envelope of services around it. Otherwise, those people are the absence of the support that that the previous panellists were talking about earlier is still there outside of child protection. It's often those support services, those early help services, that there are gaps in that need to be wrapped around the children. Social care, whether it's adults and children's combined, is probably 60 to 80% of a local authority's spend. So we see them taking difficult decisions and difficult decisions about what do they stop to add to these demands. And then where they're very challenged financially, and we've had a few local authorities recently against a trend of improvement going down, there tend to be issues around instability of leadership, financial constraints, moving money out of early help, and in all honesty, not having sufficient basic numbers of social workers to do the job they need to safely with children. You can't navigate the needs of a family through the court system, do that delicate child protection work with a huge caseload. So where there's unstable leadership, where the money's tight, where the early help is disappearing, where social workers are overwhelmed by the task, you see the decline. And in those places that are keeping the basic show on the road and keeping those things functioning well, we see a better position. Agency staff Again, it'll be a continuum. They're really good agency staff. I personally don't see that they can do the relationship-based case management work with families in an enduring way. They're good for project work. I'm pleased that the government have taken action to restrict the use of agency work and are considering that for the future. We're pleased with the pathfinders, the additional resources to extend the secure estate. But I think what we probably are all saying is that the ambitions are huge, the need is growing, and what is being able to do, because of the allocation of resources, is probably to focus on the right things, the right ingredients, but they're not yet at scale that's going to have the impact that we would all stand behind.
Which I think reflects a lot of the feedback that we've had during this inquiry. So no, I recognise that. You mentioned, Professor Michelle, the conversation around a statutory duty to report CSA, and whilst in many senses that might seem sort of motherhood and apple pie to some people, we've had quite a lot of concern raised around that, both by academics within the sector and also the Association for Directors of Children's Services, who said it's a rushed, poorly scoped and under-resourced policy that could overwhelm services and worsen the situation. I'd be very interested in all of the panel's views on that issue, and I apologise for taking a bit of time over this, but I think it is important, and we're keen to be able to feed back to ministers any concerns around that, with legislation imminent on that issue. So if I can come to you first, as you brought it up, Michelle.
Yeah, I think we need to be asking the question, as I said before, why are we in a position where we have to mandate this? The sectors that we're talking about already have significant workloads, as just been talked about with Yvette. We already understand in terms of their ability to be able to spend the time in doing those types of assessments. NSPCC just released another report just at the end of March around our ability to do these assessments and understand what it is we should be doing at that time with that child and with that wider family. So we're already pushing down so much information and requirements. We've got the minimum standards that we should be doing now as well. And I think what we need to be considering is where we are ensuring in this space. And I think that's what the concern is from the practitioners we've spoken to be able to do that and give them the capacity, the confidence to be able to make those decisions in the first place, so then they can make those referrals. Because what we're seeing in some of our evidence is they are recognising some of these harms, they are lower level harms, and some of this is again linked to the safeguarding panel around some of the issues around neglect and poverty that we're really struggling to respond to. That might be the earlier signs that something is happening, and the referrals that are going forward to children's social care that aren't meeting the thresholds. And we've seen this in at least half of the cases that we've looked at, where it's just not meeting those thresholds. The issue that you've got then around this mandatory reporting is whose responsibility is it then to chase that up? Is there we've seen the recognition of our practitioners, there's an expectation of don't come back to us with a referral unless there is an escalation. So again, there's all this complexity within the system for those practitioners on the ground to really be able to enact that. And then you've got the fear factor for our practitioners as well, which is what will be the consequences of this if I don't see something or pick something up. So I think what it's going to do with our already unstable workforce is maybe cause issues about, people joining the sector.
Yeah. But Michelle, I mean, the thing is, we all know that in children's social care, as with many other aspects of social care across the board, what we've actually seen is a heightening of levels of intervention. Yeah. The thresholds have been going up, and that's because of resourcing and increased need. Yeah. Now, Yvette was talking about demand pressures, but I mean, sometimes an awful lot of the demand is actually unknown. We know about what we know the demand is, but there's an awful lot of unmet demand and unknown demand out there. And, the discussion that we had earlier on about people having the wherewithal and the understanding in order to negotiate systems. If you haven't got that understanding and the capacity to negotiate a system, you just don't ask. And therefore, that's a demand that doesn't ever rise to the surface as far as the service is concerned.
That comes back to expectations of role for the practitioner as well. So we know from the safeguarding panel's evidence and from the evidence that we've collected as well, exactly what you said. It's the universal services that actually normally have the eyes and ears of that early indicators, that unmet need. And that's what we mean by true early intervention, whereas we're treating that kind of early indicators at the moment of harm at very targeted prevention services. And that is what a lot of people are saying is not actually early intervention. Oh. So we need to be pushing, as we always say, it's got to be upstream that we're looking at things. But it does, I think, when we're talking about mandatory reporting, do practitioners have real clarity about what their role and remit is and navigate around our policy? And just as a little insight, I did a little bit of digging. I will stop talking in a second. And if you look on your local children's safeguarding partnership websites, to just go and have a look. I did a little look around some of the areas. I'm not going to say which ones I looked at. Just to try and navigate, if I was a practitioner and I needed to make a referral and I had identified potential harms, if you're just looking at thematic areas of harms, one child practice identification, so one partnership, had 38 different documents, pages and pages long, which was just to look at how do you identify risk and what do you then do with it. And then you've got the issue of how do you then flag that. We're still not at a place where some of the safeguarding partnerships don't have automated portals. You're sending an email with an attachment that's got to be encrypted. So if we're going to mandate this, what is our system to allow our practitioners to do this in an efficient and effective way to then get that feedback?
So systems, training, the right support there, the right structure all need to be in place before you mandate it. Can I just come to you on this, Annie, because I think this is
it's issue. Really important. I mean, there is the point that's been made by others about overwhelming the system. I think the second and actually really important issue for us, I think, on the panel, is the impact on children and children who are being sexually abused either in their family or in an institution or some other kind of context. And we know from, for example, work that the Centre for Expertise on Child Sexual Abuse have done in relation to children disclosing abuse and how very difficult it is and all the kind of barriers for them, and particularly their worries and huge anxieties about what happens when they do tell somebody, and how, the forces of law and order, social workers, other people suddenly kind of erupting into their lives, into their families' lives, and how they can often end up feeling that they're the ones that are responsible and to blame and it's their fault and so on for creating a crisis in their family or wherever. And I think we've got to think really carefully in terms of the implementation of any such duty on how this is handled for children. Because if children feel that they are suddenly losing control when they already have lost control in terms of their lives, because that's part of the experience of being abused, then actually we will be compounding and exacerbating the abuse that they have experienced from somebody else. So I think we've got to think really carefully about how this would be handled for children, and that's where we need to sort of start. Yeah. I think the other thing to say is that I think there is a risk that precisely because of the issues that Michelle has spoken about, that practitioners, it could be social workers, it could be teachers, it could be police officers, paediatricians or whatever, end up being very risk averse, and so that they leap into making an assumption that a child may be being abused without doing the kind of necessary inquiry and sometimes investigation work that is required, because they're very anxious about the consequences if they don't report. And we know, and if you go back, to the 1980s and the Cleveland inquiry, that was very much where a whole system became very risk averse, and actually there were negative consequences for children. So I think those are the two things I would really want to emphasise in terms of how that duty gets implemented and the guidance that will need to accompany it.
Thank you. Anything you want to add to that, Yvette?
I think they've both spoken very eloquently, and I would wholeheartedly endorse both positions.
Thank you. Can I bring in Anna?
Thank you, Chair. I want to now talk specifically about the Hesley Children's Homes. And we all know that in 2022, the Child Safeguarding Practice Review Panel uncovered a terrible culture of abuse and harm inside Hesley residential homes for children with complex needs. And, you know, we've read about the punching, the kicking, being fed with chilies, having vinegar poured into cuts, and over 100 reports of incidents between 2018 and 2021 in a home that was rated good by Ofsted. Now, I know it's accepted by Ofsted that was that was wrong and that pattern should have been detected earlier. But what I want to focus on is what lessons have Ofsted learnt from that case to make sure that doesn't happen again.
Yes, absolutely. I'm just going to take you a little bit back. We've reflected an awful lot about our work in that time, and prior to the panel doing their review, we've done our own learning review. And I can talk to you about all the things that we've done, you know, more conspicuous care to whistleblowing, more conspicuous care to notifications, joining the dots across the piece, more training for our inspectors around disability as part of their induction, but also the specialist teams, more awareness raising about closed cultures, particular issues around children who are non-verbal. But working with CQC, and the Secretary of State has asked us to work even more closely with CQC to look at what changes need to be made to regulation, can we inspect together. So all of that is work that we've been doing and continue to do, and absolutely taking those lessons into other places. But there was, it was our inspection that uncovered cases of notifications that hadn't been made, images of children's injuries that hadn't been disclosed to us. So I think it goes back to a bit we were talking about just now about there are also people who know that abuse is happening and they don't even do the notifications that they meant to do. So it was uncovering all of that. We raised it with the police, we raised it with the local authority, and then the panel took on a really important task and wrote, I think, two reports which tackled both the systemic and the practice issues. And as a partnership, a safeguarding partnership across government, we need to be looking at the fact that children were miles away from home. In COVID, no one got in. We didn't get in. So that was part of the loss of that line of sight. We must never lose a line of sight of these children if there is another pandemic. But also, what the panel alighted on was that the need for absolute clarity. When a local authority is placing a child 200 miles away and the home local authority doesn't place any children there, how do we know what's going on when 35 local authorities... And during our inspections, we would have rung up those local authorities and said, have you got any concerns? They didn't have any concerns. We spoke regularly to the Lado at Doncaster about a place where they seemed to be taking firm action against staff who were less than good in terms of their relationships with children. They sacked people, they trained people, they restructured. They appeared to be acting, and yet with all of that going on, the Lado wasn't cited on everything. Each local authority was cited on a piece. So I think the actual individual learning is real, it's current, and we continue to focus on that. And I think the next piece is to make sure that the regulations, the systems, the clarity around Lado roles, placing authorities, that is in a better place. But just to end on a more optimistic note, we have on our children's inspections, both SEND and the social care ones of disabled children, seeing absolutely much more care and joined up there. I hope Annie's heartened by it, because these children often had acute health needs, but health weren't part of the placing, they weren't part of the monitoring. A social worker and an Ofsted inspector can't tell if a child is being over or under medicated. It's really, really important that the decisions to place are joint, the monitoring is joint, the inspection is multidisciplinary too. And I think, hats off to Annie and her team. The review tackled those systemic issues as well as the practice issues.
That's very interesting, Yvette. And you've given us a lot of information there. Are you able to pinpoint, that there's the single most important learning, if there is one?
So I suppose it would be a combination of things. We have in other places I've talked to you about the market developing in a very different way to when regulations applied, and our regulatory inspectors have to keep an awful lot of information about these places, and our system wasn't able to extract it as easily as possible. So we had a combination of losing some really experienced staff who'd been seconded out in the pandemic, and a system that wasn't easy for newer people to interrogate. The experienced person might have interrogated it differently. But just to reassure, every notification that we received, and you listed a number, they didn't all come into Ofsted. Some would have come into CQC, some would have come into the local authorities, etc. Every single thing we saw, we reviewed, and action was taken. What we're now very reflective of is constantly going back and seeing the bigger picture, seeing patterns, working with others to see the patterns that they're seeing and joining that dots. So it is those continuous lessons, I think, Annie, about curiosity, tenacity, making sure that you're not asking others and falsely reassuring yourselves, you don't have any problem, you haven't got any worries, have you? It's about getting behind, what do you think is going on in this place? And the multi-agency team, just as it is around an individual child, this is more as a system level, getting behind what is really going on for children.
Okay, thank you. Annie, what are your reflections?
Yes, I think this was a review that was very disturbing and distressing in terms of uncovering abuse of so many children and children who'd been forgotten, and the system that should have had lots of checks and balances to pick up on things at a much earlier stage, things that were going wrong in these children's lives, failed those children. There's no question in our mind about that. And I think, there's obviously been a government response to the review, and we understand there'll be further review of how that is being implemented, and you may want to come back to it. But I think absolutely what it highlighted is how lots of people and parts of the system were not sufficiently curious, they weren't nosy enough, if you like, about what was going on for these children. And you have to have that nosiness when you're working with children who may be at risk, and particularly children who had, many of these children had significant communication needs, and there was not, therefore, the kind of good communication with them about to help them communicate what might be going on with them, but also with their families and their parents. So, many of these children were placed many, many miles away from home, and parents, obviously their visiting was interrupted during COVID, but often parents can bring really good intelligence and understanding of what's going on to their children. So using that intelligence as well. And I think, as Yvette has said, that nowhere in the system was that kind of joining up of all the bits of evidence about lots of different children across many different authorities. So nobody had that big picture about what was possibly happening in these homes, in these residential settings.
If I can interrupt you, Annie, the thing that's sort of so horrifying is that there must have been physical signs that these children were being abused, kicked and punched. And I understand what you're saying, that if parents were closer, parents would see that and parents would report that. But it shouldn't be down to parents to have to be reporting that. You know, those signs should have been evident. They should have been picked up upon, and action should have been taken.
Absolutely. So, for example, some of these children were taken to local accident and emergency units in hospitals with injuries, so there wasn't the kind of questioning there. Social workers and independent reviewing officers were not, they weren't sort of sufficiently questioning of what life was like for these children. And then, despite, as you pointed out, there being a number of, significant number of complaints over a period of time from families and from local authorities, despite the many incident notifications to regulators, despite the referrals to local authority designated officers, and those numbers, and they're all documented in the report, were enormous. And absolutely, you have to ask yourself, why on earth did nobody really follow through? And I think our conclusion, looking at what happened, and of course there's still a criminal investigation going on, that nobody took responsibility and felt accountable for really joining the dots about all these different things that were happening to lots of different children. And because it was spread over about 40 plus local authorities, no one authority took that initiative. So the recommendations we've made are expressly designed to make sure you have a much more kind of connected system. So when worries start surfacing, when there's any evidence of abuse or neglect, that is immediately kind of connected with what other evidence that there might be from inspection, from local authority planning meetings with children, from the visits that they should be making, and so on. So it's about having that big picture that really helps you to know what might be going on.
Thank you. I understand that. Thank you. Professor Michelle McManus.
Yeah, I think it comes back down to the points I was raising right at the start of this, and I think what we're talking about here, again, accountability is probably the key word that you've used there, is how do we create some of these, I suppose, frameworks or structures to allow us to understand what is happening, exactly what Yvette said, behind those closed doors. We can't have the reliance on those parents, we can't have reliance on that when there are opportunities, and we see this in a lot of those really adverse, significant events, that when we look back and we post hoc analyse what's happened, there are a number of people that have had the opportunity to intervene, to do something about this. So we do need to be asking ourselves, why are we able to identify and actually flag this from an individual level, but we're not able to pull this information in together and have that accountability? And that's where the issue is there are frameworks that do exist in this space that allow us to understand who is pulling into this information. So what partners have we got as part of this that are pulling information into this, whatever it is issue you're looking at, and who's missing, and who's taking this forward, who's got oversight of this. So this is what we can have data in the social care dashboard, again, a great step forward in what we're doing nationally in terms of metrics and indicators and data. But then what we need is a framework or something that allows us to see who's accountable, who's holding this, who is missing from around the table. As we've said, a lot of the time in our safeguarding partnerships, we do have health there as our kind of tripartite ownership, but we know from our evidence how they are represented, and from strategic down to the ground in those different groups is very fragmented, very varied. So we need to be understanding how that's working in these little pockets of multi-agency working, and to be able to find out where that accountability should be and what's happening and who's got oversight of that. And you need some kind of framework to be able to deliver that.
Can I just follow up on this? One recommendation we had from the independent inquiry into child sexual abuse was to have one agency in government responsible for looking at this from the top down. Is that something people on the panel broadly support, or is that something which actually could have perverse consequences in terms of removing some of the responsibility from the existing agencies who are there on the ground? What's the balance you see in that recommendation?
I go first? One of the things we recommended in the Child Protection in England report was that there should be much stronger oversight across government, across the different departments in government, and there's at least 5+ governments who've got an interest in protecting and safeguarding children. Department of Education is obviously the lead, but the others also have a really important kind of role. And our sense as a panel is that too often within government there's a replication of the kind of siloed fragmentation around accountability and responsibility that you see happening at a local level. And there is now, following our recommendation, there is now a child protection ministerial group which brings together ministers from across government. The recommendation from ICSA of having a child protection authority is something that warrants consideration, because I think there is potentially a kind of gap in terms of, at a national level, a bringing together of the different agencies and different professional groups, and they're slightly different, who have responsibilities and accountabilities in terms of protecting and safeguarding children. The panel is probably kind of unique in as much that we are a multi-agency, multi-professional body, but our role and remit is focused on learning from serious incidents. We do get, but through that learning from serious incidents, we do kind of sometimes describe it as a bit like we provide a bit of a weather vane on the health of the child protection system. But I think there is certainly a need to think about whether you need something that actually has got a sort of a wider role, and really drawing upon and making sure that there is available the kind of data that I think we need as a nation about different aspects of protecting children, whether that's, we're talking about sexual abuse earlier on in terms of mandatory reporting, extrafamilial harm, other forms of abuse and neglect. And because although it ultimately it affects a relatively small group of children, the consequences when services don't protect and help children are obviously very significant.
Michelle, very briefly on that view?
I agree.
Agree. Okay, thank you. That's perfect length of answer.
Okay.
Can I come to Flick, or because we do need to make some progress, if that's all right, Hannah? Did you have another?
Yes, there was just a question of, we've got one more question about the government's response.
Yeah,
just very quickly.
Do you want to, any views you want to give us on the government's response so far to your investigation?
So I think we being the panel, we were disappointed that only 2 of the 9 recommendations that we made were fully accepted. The other 7 have been accepted in principle, which is obviously positive and we welcome. What we await with interest, really, I suppose, is how that accepting in principle will be realised in practice. It is that some of those recommendations are straightforward. Others we recognise are quite complex and may require changes in policy, potentially in legislation, but not necessarily. But I think we need to see, and I think what you heard from earlier on in the earlier session in terms of this particular group of children, we need to see real momentum and drive behind the agenda of helping children with disabilities and their families to have really good lives. And some of that is about, better local provision, as you heard, but it is also about making sure that when children are in residential care, relatively small numbers we recognise, but that they are afforded the very best protection and support and education that they have a right to.
This may be no consolation to you, but when we make recommendations to government, quite often they're rejected out of hand. But subsequently, down the line, quite often those recommendations come back as the government's own idea.
Yeah, and I mean, if I can just add one other thing. I mean, we know there has been a lot of work, being undertaken in relation to this whole policy arena, and that is to be welcomed, because it is a group of children who've often been rather marginalised in policy and practice. But there's a lot more to be done.
Thank you.
So just moving on to supported accommodation for 16, 17-year-olds, I was quite surprised to see that there wasn't any regulation of it before until Ofsted in 2023. There's no independent regulation before. Just wanted to look at whether these new regulations are going to cause problems financially. I think in the government's only provided 41 million per year to support the new regulations, and yet local authorities are expecting to spend 368 million. Do you think that this is going to incentivise providers to go down the cheaper residential route, or do you think they'll carry on the supported accommodation?
I think it's probably one for me. We absolutely welcome the opportunity to regulate supported accommodation. It's a gap. We have been worried about it. Local authorities were very worried that people would disappear from the market rather than be regulated. I'm pleased to let you know that more than we ever thought have applied for it, which is why we've concentrated on registration and we've delayed the implementation of the inspection regime. It's really important that we get out, because this has been unregulated, and see these places and go through that registration process. So I hope you'd endorse our approach on that. So we're seeing people come forward who have clearly had children before. We're not seeing people come forward who had, in large numbers, who had children's homes who want to switch to this cheaper sort of provision. There are some who are looking at it as part of their portfolio so that they have a place that young people can move from a children's home to. That is all positive for the moment. Local authorities, we don't look at the finances, and they are saying that they are under pressure. I worry that both the demand pressure and the financial pressure might make a local authority move children to independence too soon. I absolutely understand that you have to place them at some point, that it's important to get them ready, and when they're there, their circumstances might change, they might have a bit of a wobble, and we're not going to be heavy-footed when a supported accommodation provider is adding in support for a child that's going through this system. We need to absolutely reassure the sector that we have got ambitious standards. It's good that there are standards now, but that we are going to be a responsible regulator in doing that. But we are worried about the overall lack of supply, which we think can make people take the wrong or premature decisions for children, leaving them in potentially unsafe situations. But you will have all seen Channel 4 Newsnight programmes about some of the really poor quality children are in, and absolutely that cannot be tolerated.
Brilliant. Any comments from others about that?
No, I mean, I think fully support those points. I mean, it is of huge concern about, because these are children who will be very vulnerable, yes. And they need to have they need to be in settings where they feel safe and they are safe.
Just a quick one to Yvette, actually. Were you aware that people use handcuffs to transport children between different care settings or educational settings? And do you think that the use of handcuffs outside the criminal justice system is ever appropriate?
So I am aware. When I took up the national role, I became aware because we regulate the secure estate. It is a gap in regulation. I know in our submission we've produced a long list of gaps in regulation that we would like filled, proportionately and carefully, etc. The Welsh Government have abolished the use outside the criminal judgment, and so I absolutely understand that policy position, which will be a matter for the policy makers. I think in practice, and Michelle may and Annie may want to comment, there are better ways to support children in managing moves and helping them self-regulate. And a lot of places have done some really good work on safe handling, safe support for children in crisis. So I personally would not be advocating for it outside the criminal justice system, but Ofsted sits outside the policy decision making.
Okay. And then to Michelle and Annie, what can the government do to prevent adultification and unconscious biases against certain cohorts of children within the safeguarding system and the wider children's social care system?
Well, you've got Jadine
Davis,
who certainly is the expert in this area.
Yes, and it's something we've written about and reflected on in our recent annual report. So adultification is just for the avoidance of doubt, is really when children or professionals see children not as children, and so certain groups of children, so for example black children, may be more likely to be seen by professionals as having kind of responsibility for their own actions, not being vulnerable, and therefore they're treated like adults when of course they are children. And I think we see this particularly in terms of children who are at risk of extrafamilial harm, so children who've been sexually exploited or criminally exploited. And it is hugely damaging because it means that the risks that they may be experiencing, their vulnerabilities, their needs are just not kept centre stage and the heart of practice.
In simple terms, it's victim blaming, isn't it? Really?
It is a form of victim blaming, that's right. So I suppose one of the what we've been encouraging in the panel is that for local safeguarding partnerships, when they're undertaking reviews about children, tend to be teenagers, but not always, who have, for example, been caught up and criminally exploited or sexually exploited, that they really focus on these children as children, and that they constantly reflect on whether there is any kind of bias and assumptions that they're making in their practice, so that they're properly protected and kept safe as children. And as Michelle said, a member of the panel, Janine Davis, has written extensively on that, and I think we quoted it in our evidence to you for this meeting.
Yes. Just for completeness, in advance for joining the panel, she'd done some really good training for Ofsted. I think it's really important that as the inspectorate, we model the same practice approaches, anti-discriminatory approaches. It is with great sadness that I still report that, and it will be on the serious youth violence JTIs, that we still see adultification of particularly boys into the criminal justice system. And it's something that as all practitioners, we need to be humble, we need to challenge ourselves, we need to question, and we need to give a safe space where we can really make sure that our practitioners are making the right challenges when these things occur.
I think as well it's about how can we be more proactive in looking at our own partnerships and our own teams and the cohorts that we're dealing with, because certainly having done so much work around county lines and risk of serious youth violence, sometimes it's the type of harms that also have that, I suppose, that different type of treatment, because we've got this real conflict around victim and perpetrator characteristics. We can only put people in to one box in our systems. So, what are we encouraging, both from kind of corporate safeguarding annual reports, from our partnerships, to understand and look in our own house to understand our demographics, and again, some of the dashboard work that is being done may enable us to see some of those, I suppose, trends where we need to take a deeper look at what's happening, but we need to be quite proactive with that. We need to be looking at that quite regularly. But again, it comes into that multi-agency layering of data, because we often see it's your frontline service that will be taking that initial decision as to how they see them, and that then basically will put the pathway of where they go, whether that is as a victim or whether that's as a perpetrator, and that can really have some consequences.
Can I just apologise to the panel? I'm going to have to step out because I've got a hard stop at 12 o'clock. I want to finish the questioning, and so I'm going to hand over to Ian just to chair the end of the meeting. But thank you very much for all the evidence you've given so far. It is too important a subject to cut short, so I do want the meeting to continue just over the last few questions. Thank you.
At least you're left with quality, if not quantity. Don't worry. Right. I'm next anyway. And Yvette, I'm just wondering, there is in your evidence from Ofsted, it was stated that the Care Standards Act of 2000 is in serious need of reform. So what reforms are needed?
I think we probably gave you quite a detailed note, and I've mentioned some today. So going back to Hesley, we've got different establishments that were set up at different times with different governance and different accountability system. We need to regulate settings according to the risk of children, not to the historic way they were set up. We need to be more ambitious about our expectations of children. And there are just all sorts of gaps in the regulatory landscape. For example, and we've talked about this before, we regulate at a setting level. And absolutely that's right. We need to know children are safe, that the manager is a fit person to practice. but we don't have the opportunity to look across a group of settings and take regulatory action, even though more regularly that is where the decision's made. So there's some strategic stuff, and there's some more granular stuff in terms of bringing the standards up to our expectations of today.
So the landscape has changed rather dramatically since 2000, and would need
so
to reflect that
we
in
would
terms
have
of
had
regulations.
children's charities and local authorities as the main owners of children's homes. 80% of children's homes are now owned by the private sector. The top 10 companies own 30% of the provision. As we've talked about in other places, it isn't in the right places to meet the right needs of children, so children are being transported too far away. There needs to be financial oversight. That may not rest with Ofsted. There needs to be market oversight and stimulation of the right provision in the right places. And certainly in Ofsted, squarely in our places, is group oversight, where decisions are taken at group level that impact on children.
Okay, thank you very much indeed. Also to you, Yvette, Ofsted has called on the government to extend its powers to enable scrutiny of social care groups that own and run multiple children's homes. We've just talked about that. So what concerns does Ofsted have about the lack of scrutiny of these groups? Is anything particular? I mean, does this kind of reflect, in schools, the inspection of academy chains as opposed to just individual schools?
So we review multi-academy trust providers. Yeah. We do a few of those a year. We don't systematically review that, and that is it's a good question. As how things are managed have changed, should Ofsted have a line of sight of that intermediate tier? And it's absolutely the same in terms of
corporate governance, isn't it? Really, that's
and where decisions are now being taken in a different place. What should the scrutiny be? I think there are other issues that ADCS and others will speak about in terms of ownership and appropriateness of ownership, appropriateness of profit. We're fundamentally sighted on the sufficiency and the quality side, but even in that space, we think there's work for us to do. For example, we talked about Hesley. They owned a whole plethora of provision, including adults provision. And actually, if you can join the dots across providers, you might have a slightly different view to an individual setting. And so it gives us the opportunity to remedy one of those gaps as well.
Just for the record, Annie and Michelle, I take it you would welcome Ofsted's oversight at those levels as well. Yeah, definitely. Okay, thank you very much. And lastly, Yvette, do you believe that Ofsted should increase its interactions with foster and kinship carers, including through both assessments and support? And does Ofsted have the resources to do this? Probably no.
I think HMCI has spoken eloquently about new asks of Ofsted and a 29% decrease in our budget over the last 10 years. I'll get that bit in for as you would expect. So our inspection has to be proportionate. We assure a local authority's service. We assure their assurance, as it were. We no longer have a section on adoption. We no longer have a section on fostering. We, of course, through our footprint in local authorities, through our footprint in inspecting fostering and adoption agencies, we will talk to foster carers. We cannot replicate, nor perhaps should we, what we expect local authorities to do about tackling their complaints, supporting their training, getting the evaluation of the support they get. And we will check that out on the ground, and we will triangulate it with the views of foster carers, and we do our point in term survey. If we were to replicate the assurance system and see everybody, all of the partners, the multi-agency arrangements locally, we need a very big footprint, and if I could give another plea, if there is more money, I certainly can do more in Ofsted, but we absolutely talked today about the real pressures on frontline delivery, and I would personally make sure that is rectified before dealing with some of the stuff that we've also talked about Ofsted. We've got to improve the availability of social workers. Local authorities need enough money to provide the early help, to do the prevention at all levels and those things. And then absolutely we stand ready to check that it's happening on the ground.
Thank you very much, Caroline. Thank you.
Thank you to the new chair. A question around the inspectors themselves, and we talked about the quality of inspections earlier, and obviously much will rest on their own engagement. What procedures are put in place to make sure that local authority children's service inspectors have the sufficient expertise that they need in children's social care and with children with complex needs?
So we recruit from the sector. We have a substantial induction pathway. And children with disabilities will be inspected both by our HMI in the local authority setting, but also our regulatory inspectors who come from the care sector, including residential care. We provide we provide additional training, and I talked about some of it earlier in terms of disability in general, non-verbal children, complex needs, closed cultures, etc. And as part of their pathway, they supernumerary, they shadow, they'll be alongside, and then they'll lead when they've worked through that process and they've been fully signed off. We get feedback from local authorities and children's homes following inspections. We'll look at any complaints and concerns raised throughout, and we look at our QA process. So in a relatively small team, so we've got 40 HMI and we've got about 300 regulatory inspectors, we've got 3,000 children's homes and lots of other settings. We can't always absolutely match specialism for specialism. We will have people who've come from fostering and adoption. We'll have people who've come from residential special school. We make sure that our teams are represent the complexity and the organisations we're inspecting, and we have to be really confident that our more generalists can step up to that. But we have a mixture, and that sort of tells you the QA that sits behind it to help us assure that it's happening on the ground.
Challenging to recruit and retain inspectors? In this particular field? Our
most challenging portfolio across Ofsted at the minute is regulatory inspectors in social care, because we're expanding, and because for the very reasons that you've talked about earlier, if the sector is struggling to have enough people, us taking them out to inspect and regulate the sector is an equal challenge. So it is absolutely a challenge. That being said, we have recruited well. We've got 33 new inspectors for our supported accommodation. They've got a really good, deep experience, and we're delighted to have them on side. But the challenge we have just reflects the challenges that the sector has.
Thank you. And finally, currently disabled children's care is inspected through both local authority children's services inspections and local area special educational needs and disabilities area inspections. You referenced earlier around different sort of frameworks being set up at different times. Why are there separate processes, and does this create dissonance or friction, or is this a very positive triangulation?
So they are different regimes. They were set up at different times with different purposes. So the inspection of local authority children's services is merely, I say this to Annie as an ex-DCS, it's merely the inspection of social care. So we will look at, and just thinking about my time as a DCS, I would have had, 1,500 children with what was then a statement of special educational needs. I might have 130 children open to my disabled children's team. And they were children who probably had an enduring lifelong condition. So on the inspection of ILACs, we always visit the children with disabilities team. We sample their cases. We look at how they are doing exactly what the colleagues earlier were saying about they're enabling children to stay safely with their families. They're supporting them, be educated locally. We look at that, and I've seen them in different places. I've seen them put with adults, so that you've got continuity there. They tend to lose their child focus. I've seen them closer to child protection when they're really good on child protection and they lose sight on disability. And I've seen them in places where they've got that right.
Both are important. They're complementary rather than.
I would argue and say that the evidence suggests that they're better when they're in children's services, and they need to be close to. They need to have the specialist knowledge of disability, but they also need to be close to the risks of safeguarding, because We know that disabled children have additional risks. We saw that in Hesley. They're not just risks associated with their family, there are broader risks from disability.
It's important to maintain the two, because I was going to ask around the pressure then and the burden on settings to be going through multiple different inspection regimes. How does that work?
Settings wouldn't. So the local authority, there will be a team, probably one team in the local authority with a team manager and social workers who are supporting those children. And as part of our overall inspection of the local authority's social care services, we would look at that team, we would sample cases, we would talk to families, we would meet children, and we would do what we do with all the other groups of children. And we'd report on how well social care was supporting those children in their statutory duties for social care. On an SEND area inspection, we're looking at a local partnerships arrangements for all children with SEND, which in Hampshire is 15,000 children. It might be those requiring some school action supports, those with an EHCP, and some in that will have an enduring health and care need for a lifetime. And what we're looking at in that is there a preventative model? Are the partners working together? Are they commissioning? So in that mix, we're looking at a fragmented education system, we're looking at a very diverse health system, we're looking at a place that might have two, what are they called these days, Emily? I'm going to say a PCTs, or ICB, Integrated Care Board, that's it. They change their names so often. So they might have two integrated care boards. They may not have I didn't have a hospital in Merton, so my children who needed a hospital service was 2 boroughs away. So I don't want to say that the local authority children's services is but it is much simpler. It's contained. Everything in that disabled children's team is managed by the DCS. They have a line of sight. What we're looking in area inspection is a complex system implementing a 10-year reform programme, and they're in year 1. And they would argue that they haven't had the resources to deliver that, and they're also delivering in the context of whether it's COVID disruption or whatever. So what we often report is that there is that disconnect. There is a long wait for health services. Commissioning jointly is a struggle, because who should pay, who should be accountable, who should be delivered. So I am not surprised that Kent could be outstanding in their children's services partnership and could have huge challenges as a partnership in the locality. But I also think that we need to be much clearer what we expect of those local arrangements at this point in their journey, and what we expect for the future as well.
Thank you. Is that some follow-up questions and another inquiry?
Caroline, thank you very much indeed. Look, can I thank everyone very much for this morning's session, which is straight into this afternoon. But no apology for that, because it is important stuff, and I think we must never forget that behind all of this is services for children, which is the most important thing. So can I thank the panel, thank our previous panel, and I'll bring the meeting to an end. Order. Thank you.
The proceeding has ended. 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 The proceeding has ended.